as well, I'm told. So thank you for turning out to hear about this important topic. It's a pleasure to introduce our guest speaker today. Professor Marianne Bitler is a professor of economics at UC Davis. She earned her PhD from MIT and then had various academic stints at Rand and UC Irvine and other places. She's a consultant for the National Economics Bureau. She's done a lot of important work in poverty, welfare, social justice, and the like. And she'll be speaking to us today about the war on poverty, which, like all social programs, had both intended and unintended consequences, the latter of which are not often looked at too much. You know, in the 1960s, Lyndon Johnson fought two wars. One, obviously, was Vietnam. It was unsuccessful. The other, the war on poverty, I guess the results are still coming in. So we look forward very much to hearing your remarks, Professor Bitler.
Thank you. Thanks to all of you for coming today, and I'm getting over this cough flu thing, so luckily I have a mic, but I'm going to try to talk quietly, okay? And this I have to start off with, first, the funders always want to be acknowledged, but I'm going to talk about some work in progress of mine with a colleague of mine at the Department of Treasury, so I must issue this disclaimer. The findings, conclusions, views, and opinions are solely that of myself and my co-author, Ted, and do not necessarily represent the views of anyone else anywhere, but particularly not the Department of Treasury, the NIH, the NSF, or the US government, okay? So I'm going to start off by just reminding you all what the war on poverty was. So in 1964, in his State of the Union address, President Johnson declared a war on poverty. Congress quickly passed, well, relatively quickly for Congress, passed the Economic Opportunity Act, which created the Office of Economic Opportunity to administer local funds. And what did this office do? It was run by Sergeant Shriver, and we're just coming up recently on the 50th anniversary of all this, which is why I wrote this original paper with my colleague Lynn Carolee, and why there's been a lot of focus on this, because 50 years is long enough for effects in the long run to materialize. And that's one of the points of this talk, is sometimes benefits or costs of programs don't show up for a really long time, okay? So as Rich said, we're still learning about this program. So the Office of Economic Opportunity administered the Community Action Program, and we still have a lot of community action agencies around the state and elsewhere. Project Head Start, which was set up to improve school readiness for low-income children. Job Corps, which was a training program, and a whole bunch of other things, including expanding housing assistance, legal services, which provided access to legal help for low-income folks, community health centers, family planning grants, VISTA, Upward Bound. And there is an emerging literature on a bunch of these other things, so I could go on for a lot longer than 45 minutes. But I'm mostly going to focus on a few programs today. Okay? So as part of the war on poverty, we also had the Food Stamp Act of 1964, which allowed counties to join what had been up to then a pilot program for food stamps in 8 counties. We had the Elementary and Secondary Education Act, which established Title I. We had the Social Security Act of 1965, which created Medicare and Medicaid. Medicaid was just an afterthought, but now is quite important as a part of our healthcare safety net, and started the school breakfast program. Shortly after the war on poverty, there are a number of other important programs that were established. So the Earned Income Tax Credit provides refundable tax credits for workers. When it was started, it was only for families. Supplemental Security Income, which is administered by the Social Security Administration, which is means-tested cash benefits for disabled and aged people, was established in 1974. And the WIC program, which I've worked on a lot but probably won't talk about so much today, is quantity food vouchers for low-income pregnant women and children under 5. The first clinics were opened in 1974. Okay? So what kind of spending was this? These numbers come from a JPAM article in the same set of articles as the paper that I'm summarizing the results of. In terms of the Great Society, in 2014 real dollars, in 1965, spending was $45 billion, and And then by 1972, it was up to $140 billion. So you can see that these programs were quickly ramping up to spend a lot. In terms of what happened to poverty, which had been the precipitating argument for, along with a lot of attention to hunger in America and to other disadvantage, been the precipitating argument for passing these laws. Poverty was 15.6% in 1965 and down to 11.9% in 1972. In terms of participation or how many people were actually using these programs, just to give you an example from food stamps, in 1965, right after the program was opened up to counties that weren't part of the pilot, there were about 500,000 people participating in the program. By 1974, there were 15 million participants. So you can see that these programs grew pretty quickly. Okay? So now let me just give you a little bit of a preview about what I'm going to talk about for the rest of this. So most of my research is about kids, and so this talk is organized around programs that are aimed at the non-elderly and children. Okay? It's also going to be organized around the type of benefits. In the U.S., we have this very patchwork safety net with all kinds of different programs. We have cash programs like TANF and AFDC, or the Supplemental Security Program, Income Program. We have in-kind programs like food stamps. In-kind just means that you get a quantity of stuff instead of cash. We have investments in human capital. And I'm going to focus on the long-run impacts as well, which is part of an emerging economics literature. So what are the kind of programs? Well, I've already split them into original war on poverty or earlier, which I already mentioned a bit about these, or later programs. Just to give you a sense of this patchwork aspect of our safety net, these are the main programs that we have for non-elderly families, along with housing, which is much more limited. Not everybody who's eligible for housing assistance or child care assistance can get it. So we have cash welfare. What used to be AFDC is now TANF. This is means-tested support available for low-income families with kids. We have food stamps, which is really our only nearly universal safety net anymore. Okay? There are general assistance programs in some states, but not all of them. So food stamps is means-tested. You have to have gross income under 130% of poverty and net income under 100% of poverty. Not everybody would include the earned income tax credit, but as part of our big shift away from cash welfare and towards in-work support, the earned income tax credit is now paying out a lot of money to low-income families. It's means-tested, but requires employment. And the more generous part is categorical, because families with kids get more. We have SSI, which is means-tested and categorical. Medicaid, which was categorical until ACA in the states that have adopted the expansion. So anybody under 138% of poverty is eligible for Medi-Cal in our state, but that's not true across the board, as I'm sure everybody knows. Some states chose not to participate. And then we have the WIC program, which is means-tested and categorical. Only pregnant, postpartum, and breastfeeding women and children under 5 can get it. Okay? So how big is this safety net? Well, these are all numbers from 2010, because that's what I had handy from this paper. So in 2010, just to give you some perspective, there are about 35 million families with children based on the CPS, and about 79 million families total. Okay? So not all these programs are just children. Medicaid also gives provides a lot of health care to disabled and aged adults. But the Medicaid non-disabled child caseload is 27 million. Spending was about $82 billion in 2010 dollars and $2,300 a year per kid. Okay? TANF is a tiny program anymore. It's really shrunk since we changed our welfare system. So it's only 2 million families, $11 billion, and about $400 per month for families on the program. Food stamps, even in 2010, was big and grew to still big after the recession, but at one point during the recession, 1 in 7 people in America was on the food stamp program. So 19 million families, $65 billion, and about $285 per month for families on the program. You can see the earned income tax credit is even bigger. This is including people who are getting it as adults, too. But 26 million tax units. So tax units is like a tax filing unit. Think family. Nearly $60 billion and nearly $200 a month. Okay? So you can see that this program is quite large and dwarfs this former program that was a part of our cash safety net. SSI, is the non-aged part of SSI is smaller, but it's still pretty valuable per person. And then WIC is very limited in terms of age. So again, kids can only get it till they turn 5. But it's very big in terms of touching people's lives. Nearly half of births in the U.S. are paid for by Medicaid, and nearly half of kids are on WIC at some point. So in terms of footprint, this is maybe the biggest program in terms of touching people. It's $7 billion, of which $5 billion is spent on food, and the other part is spent on the other things that the program does. And according to USDA, the food costs for WIC are about $41 a month per recipient. So it's not as big as the other programs. It's important to remember that it's probably more valuable than that to the recipients because a lot of them get formula, which the state gets rebates for, so it doesn't cost the state the whole amount. But the actual cost to a family of the formula they get is more like $150 a month. So it's quite valuable for those who are using the formula. And then Head Start, which is this preschool, targeted preschool for low-income kids, only has around 1 million people on the program, spent $7 billion. So it's about $8,000 a year per recipient. It's not always year-round, but I just converted that into an annualized number so you could compare it to the other ones. Okay. So what am I going to do? I'm going to review the causal literature about the biggest of these. I'm going to look at some intended effects, which are things like poverty reduction and sometimes self-sufficiency, and some unintended effects. And then I'm going to talk about this emerging economics literature about the long-run effects on family formation, investments in children, health, and earnings. Okay? Then I'm going to talk about this ongoing work of mine that looks at the long-run effects of the food stamp program on earnings and the food environment. So what was the point of these programs when they were started? We have cash aid like AFDC to provide a floor for consumption so that nobody goes entirely without. We have the food programs to avoid hunger and malnutrition. The goal of the health programs is to improve health. Human capital programs like the one I'll talk about here, Head Start, but also Title I and Pell Grants. Their goal is to increase educational attainment and raise wages. And sometimes there are intergenerational goals for these programs. So we don't want to just affect the adults who are eligible for the programs, but maybe give their kids a head start or a step up in life. Okay? To give you a little context for other things that are mattering as we talk about what's going on now, there have been a bunch of other important changes over the last few decades. So in the US, we've moved from an out-of-work assistance program, the AFDC program, which provided families the biggest benefit if they didn't work at all, to an in-work assistance program, where TANF is tiny and people can only get the EITC if they work. Okay? There are other important factors that are going on in the background. The business cycle, we had a bad recession in the 80s. We had a bunch of bad recessions before that. Then we had this period that the macroeconomists call the Great Moderation, where everything looked great. And then we saw the Great Recession again. Okay? So the Great Recession, terrible for people, good for research because it provides really bad economic shocks. So you can so conditional on it happening, you can use it to understand how the programs respond and how that might be different from the past. We have increasing wage and income inequality. Those things reached their lowest levels in the U.S. for at least as long as we can measure in the 1970s and have been going up ever since. There's some debate about how much inequality is changing in wealth recently, but there's no doubt about which direction the trend line is going. And we've had a period of changing social norms. Okay, so I told you what the intended effects of these programs were, and now I want to tell you what economists think about when they're talking about these unintended effects. Okay? So I'm not going to show you any equations, but for those of you who want to know, I'm talking about the standard predictions of an economic model of a cash transfer program with an utility maximizing recipient and means testing. That's it for the economics for the talk. Okay? So the way most of these programs work, you get a certain amount of benefits, and then if you earn more, you lose some of your benefits. Okay? And we call that the benefit reduction rate or benefit reductions. Okay? So because your benefits go down when you earn more, we think that these programs should disincentivize work. They should make you a little less likely to work than otherwise because you can just get the benefit for doing nothing, or you can work and get the same amount of money. Okay? You can see why that might cause some people not to work as much as they would if the program didn't exist. Okay? Many programs have asset tests, so you're only eligible for the programs if your assets are also under a certain amount. and that might lead to disincentives to accumulate savings, okay? That's true for all kinds of programs that work this way. It's not just welfare programs. It's true of programs like Social Security and anything else that has these kinds of rules built into it, okay? So that's some of the unintended consequences that economists are thinking about when they think about programs like these. There's also this concept of an iron triangle. So one way you can make the work incentives better is if I earn one more dollar, instead of taking the whole dollar, I can only take part of it. So for example, the food stamp program only takes away 30 cents for each extra dollar you earn. You only lose 30 cents of your benefits, whereas the old AFDC program took a dollar for dollar, okay? So I can make the program work better in terms of work incentives if I don't take away all your benefits when you earn another dollar. But the problem with that is that means that a lot more people will be eligible for the program because I just changed where the program cashes out, where it breaks even, where you lose your eligibility, okay? So there's no way to have better work incentives and not have a lot more people on the program mechanically unless you reduce the generosity of the program. So that's the challenge that the policymaker is always facing with these programs, okay? Another unintended consequence that economists like to think about is categorical benefits. If the only way you can get, for example, a program is if you're a single mother, that might be an incentive for some people to stay a single mother or become a single mother relative to being married when they would lose access to the benefits, okay? So there's the scope, although very little evidence that the effects are big, that some of these programs could lead to changes in family formation, okay? Often when the programs are set up, people aren't thinking about intergenerational effects, or if they are, they're thinking about effects on kids, but they're not thinking about effects on kids' per se. So that is a potential intergenerational effect. And then, there are issues with take-up and stigma. So take-up is the share of people eligible for a program who use it, and almost no social program has 100% take-up in the US. Even something like the EITC, which everybody loves the EITC, economists love it, everybody loves it because people work and it has good effects on them, okay? So what's not to love? Take-up rates for that program are 75%. So a quarter of the people who are eligible are not signing up for the program. Why is that? Sometimes it's information, sometimes it's hassle costs, sometimes it's stigma. So stigma is this idea that you might not, I'm going to get a sip of water. Stigma is the idea that you might not sign up because you think other people don't like the fact that you're using this program, okay? We know there's a lot of stigma around a lot of these programs. Some programs have more, some programs have less, okay? So I just want to say a couple things about in-kind programs now. So in-kind programs just mean that you're not getting cash, okay? Economists love cash because it's more efficient. You give people cash, they pick what they want. They don't do what you want, they do what they want. That's more efficient from the perspective that economists measure efficiency by, okay? But lots of other reasons why people have in-kind programs. People who don't necessarily trust the judgment of the people who are receiving the programs, like in-kind programs. So there might be a concern by some that if you give people cash, they'll spend it on things you don't want them to spend it on. It's your money, you the government planner or you the taxpayer, and so you restrict what they can do with the money to make sure that it's going to the things you think it should go to. But there's a backward channel to that economists think when you give somebody, like food stamps, you give somebody $50 of food stamps. If they were already spending more than $50 on food, then the simplest economic model suggests that they just treat that like $50 more cash they have to spend, okay? So only if they think of that money as being different from other money can you get them to do something different than they would with the cash, okay? So in particular, most economic theory predicts that if you were already spending at least as much as whatever you're getting, it's not going to really change very much how much you spend on the thing that the in-kind benefit is for. So that $50 extra of cash is not going to lead to $50 extra of spending on food for that household, okay? If you were spending less than $50 on food, then maybe you could get a big effect on your food consumption. The research suggests that it's in the middle a little bit, but certainly economists don't expect these in-kind programs to lead to one-for-one increases in spending on the in-kind benefit, okay? Now, behavioral science and some dynamic things predict otherwise. There is some evidence that people spend food stamp benefit increases differently from cash. So they are more likely to spend it on food. They think of it as being for food because it's labeled for food. And there's plenty of evidence that everybody acts this way a little bit, like all your different money is in different pots, even though it really should be fungible. So I thought there was this great article by Sendhil Mullainathan, who's a behavioral economist, sort of thinking about his retirement spending. He hadn't touched it in 15 years since he started his job, and I realized I haven't thought about mine since I joined the UC, and that's probably not the most efficient use. I should really think of it all as being all in some pot, but that's not how I think of it. So if the economists don't think of it that way, then probably other people don't either, okay? All right, and so I already said this bit about part of why we give stuff in kind is because we think it will force people to consume the good we give them, okay? So I'm just going to take 2 slides to just mention some reasons why it's hard to get good estimates of some of these programs, okay? So something like the food stamp program is a national program. So the rules are more or less the same everywhere. And so you can't compare different states' rules to understand how the program works. So I'm just going to remind you, why can't we just compare recipients to non-recipients to understand how these programs work or look at time trends? Well, we know people who use these programs look systematically different than people who don't use them. They look different in terms of their education, their age, their disability status, and their single parenthood, even when those are not categories that are required to participate in the program, okay? Well, if all of these things are different, there's probably stuff that we, the econometrician, or we, the person running the regressions, or we, the other people, can't see that's different about these people, okay? So then, when you make a comparison, you might overstate or understate the true effects of the program. That's why we don't just compare people getting programs to people who don't, if we want to understand the causal effect of the program, okay? So take food stamps. I've done plenty of descriptive work with data on people who are getting food stamps. They're sicker than the general population, even if you looked within a low-income sample. But it's not. Sometimes it's for things that probably predated their food stamp use. Okay, so it's not as though food stamps is necessarily causing them to be less healthy. It might be the fact that they were less healthy that led them to get on food stamps. Okay. Well, then what about trends? Why can't we just look at trends? Well, trends are useful. Time series data is useful, but it's important to remember that they can be driven by other things. Okay. So when I say causal estimates, which is the stuff that I'm trying to focus on in this talk, or at least what economists think of as causal estimates, I think we think our comparative advantage with other social scientists is that we think harder about causality, and I'm sure that's not what they think. I'm not sure what they think our comparative advantage is. But experiments are the gold standard. If we really want to know what things did, we should run experiments, okay? So why don't we run experiments for all these things? Well, first of all, sometimes it's unethical, right? You're not going to say, we're going to let half the population never go to college, right? That's just not going to happen. But also it's super expensive. And so there's been a trend away from doing these really big experiments. Now we have funders like the Laura and John Arnold Foundation who are funding a lot of experiments in various places, but that's because they want to give away a lot of money. Governments don't necessarily always have the money for that, okay? So these experiments are great because they make sure that there's nothing about your characteristics that's associated with whether you get an offer of a program. Okay? When you can't get experiments, the next best thing from my perspective is quasi-experimental variation, or something that's like an experiment. It's not an experiment, but it's like one. What's an example? One I'll talk about later is just this idiosyncratic adoption of food stamps. So some counties joined food stamps early. Some counties joined food stamps late. There's anecdotal evidence that it's not because that one county was with it and one county wasn't. I've looked at these memos that sort of talk about how states were even suggesting which county should get it. Sometimes the counties wanted it, sometimes the state wanted it, sometimes USDA wanted it. So there's some plausible variation that makes it seem like when you got this program was somewhat random. So you would want to get the program, and then it was also limited in terms of how much money there was. So they couldn't let every county who wanted to get off this waiting list off of it, okay? So that combination makes it somewhat like an experiment. I'm convinced, because I'm working on this, so obviously I must be convinced it works. I'm convinced it's quasi-experimental. It's random when the county got the program. So then you can use early adopters versus later adopters as being similar to the kind of good variation that gives you experimental evidence, okay? The next best thing after that is to put a lot of controls in the regression, but that is not usually enough to satisfy at least the economists. Okay, so what kind of variation have people used to try to understand what these programs do? So this is a whole list of programs. Again, I'm not going to talk about all of them. For many of them, we have some experiments. Sometimes the experiments were recent, so that's great because it's more likely to apply to our current setting. A whole bunch of papers, and I'll talk about some of these, are using rollout of these programs that came into being in the 1960s or were changed a lot then. Sometimes you can use stuff about federal policy. So in my work on the welfare reform, which I'll talk briefly about, a lot of papers have been written using differences in when states adopted TANF. So there was about a 2-year period of variation with TANF, and then there were these pre-existing waivers that are like the 1115 waivers that Kentucky wants to use to impose work requirements in Medicaid. And because of, so these waivers happened across the 90s, so there was a lot of time variation in when places had something like TANF and not. So that's the kind of variation federal policy can give you and state and local policy can give you. Sometimes there's an exogenous formula. So sometimes you get something until a test score is past a certain point, and then you don't get it anymore. Or you don't get it until your test score is above a certain point. That provides those exogenous kind of formulas that decide when you can get something are great. And then there's the observational studies that I'm sort of suggesting aren't the best evidence. Okay? So I'm going to start talking about AFDC TANF. AFDC was an entitlement program created in the 1930s, although the last state didn't join until the 50s. And it was changed largely to a block, well, it was changed to a block grant program in 1996 under President Clinton. So we also just recently passed the 20th anniversary of this ending welfare as we know it. And the new program, the TANF program, is quite different. So these are characteristics of the old AFDC program. States had, there was state variation in benefits and eligibility. There was a very high tax rate on earnings after the first few months on the program. Every dollar you earned, you lost $1 of benefits. There was no time limit on the program, so you could stay on it until your youngest kid turned 19. And it came with a bunch of other things. It came with Medicaid, it came with food stamps, and it came with eligibility for some other stuff, okay? So as we went across time, there were increasing concerns about rising welfare caseloads, which peaked in 1994. There were concerns, these led to these waivers that I mentioned. They were concerned about intergenerational transmission of welfare dependence, and this led to PRORA, okay? So we went from the old program to this new program, TANF. TANF is a block grant. It has a lifetime time limit for use of federal dollars of 5 years, as opposed to when your youngest kid turns 19. There was a much stronger emphasis on work, and there was tons of state flexibility to spend the money on other stuff aimed at higher income folks. So 80% of the dollars for AFDC got spent on cash assistance to very low income people because for most states you lost access to the program, well before the poverty limit, okay? This new, the new program TANF, states can use it for lots of other stuff. It's a block grant, not an entitlement. And for example, many states pay for a big chunk of their state EITC, the refundable part of their state EITC with their TANF dollars, okay? Which is still targeted to low-income people, but not to the people at the very bottom that the old program used to serve, okay? States had a lot more flexibility, so part of the argument here was, let's open up the lab to the states and let the states do what is more efficient because they're closer to what's going on the ground, okay? So that was part of the argument behind this. And some states have very tough sanction rules. Some states have lots of carrots. So they changed the tax rate on earnings to be much lower, okay? So what are some of the results of this transformation that we learned about during the Great Recession? And this is some work of mine with Hilary Hoynes, who is a professor at UC Berkeley, used to be at Davis, and sometimes Alira Kuka, who is a professor at SMU, okay? So TANF no longer acts as a stabilizer, all right? So this is not the world's greatest graph, but this is the Great Recession here. What you can see here is, this is from a Hamilton piece, a document of ours that characterized some facts about what this did and then made some suggestions for changes to the program that are not happening. Okay, so this is single mothers not working. You can sort of see it's going along, and then it goes down, and then it goes back up as we get on. So sorry, this is welfare reform. Let me see if I can see on my own where the Great Recession is. No, I can't. So this this graph ends in 2012. So the Great Recession is like over here, where you can see this big increase in being non-employed for these single moms because the Great Recession is hitting. And yet, this is TANF AFDC families. So if this program were acting as a stabilizer, or in the old days when it was an entitlement, when things were bad, more people would apply to the program, and you would have seen the rolls go up. Okay? But you can see here, the program maxed out in terms of cash aid right before Prora and goes down. And you can see this in lots of other ways. So since I warned you that you shouldn't just trust trends, this is also apparent if you slice the data in a lot of other ways. Okay? And it's also apparent if you look at participation in the program as a function of the unemployment rate as a measure of how bad the cycle is, and you interact that with being in this post-Prora period, the program is not countercyclical anymore, okay? Even when you control for a lot of other stuff, like you use fixed effects for state and fixed effects for time, so you're getting within state across time variation. The program just isn't countercyclical anymore. It used to be countercyclical. It used to go up when times were bad, and it doesn't anymore, okay? The program is reaching fewer poor families. This is the number of families receiving AFDC benefits for every 100 families with children. There's been a lot of concern about data sets, survey data sets not well reporting AFDC, so the numerator here comes from administrative data, okay? So this is administrative counts of people getting AFDC for 100 families in poverty. That's from the CPS, okay? So what you can see here is we've gone from 72 of every 100 families getting it to 26. So it's not reaching, the cash part of this program is not reaching people anymore, okay? And then finally, here is a lesson, I think, for those who want to use block grants but still constrain states to spend the money on the people you used to target. You gave states flexibility, and they're spending it on other stuff, okay? So only 25% of the TANF block grant is spent on cash assistance now, okay? That means 3/4 is being spent on other stuff, okay? Even if you were to look at work-related stuff, so that includes child care grants and other work assistance, it's still going to be a low number. So California is a very generous state, as is Maine. So 46% of our TANF dollars go to cash assistance. But you can see here, Illinois, I don't really know what goes on in Illinois. I don't have a story for Illinois. You might have your priors for some of the other states which are choosing not to spend very much of this on cash. But very little of this is going to cash in some places. And that's partially because it's very hard to set up a block grant and still constrain the states to spend the money on what you wanted to spend it on. So they tried really hard with TANF to make sure that the states were, at least the cash part was getting spent and only on the stuff it was supposed to be, that the people were working. So, at a conference about the 20th anniversary of TANF, we had somebody from a southern state who works running the program say, oh, wow, okay. All right, so we're going to move forward because I'm down to 5 minutes. I don't get the extra 5 minutes because we started late? Okay, 10 minutes, so I don't have to race. So she said it was a real challenge for the state to track all the hours that all the people were spending. And all these places that are thinking about work requirements for Medicaid are going to face the same challenge. If you're going to say somebody has to do 20 hours in these different activities, then you're going to actually have to, if you don't just get everybody to stop doing the program because they don't want to do that, you're going to actually have to track what those people do. And that's going to be onerous for the state administrators, okay? So in terms of, I'm just going to go on to food stamps because that's what you guys came for probably. So these papers on rollout, there's a big series of papers by Hilary Hoynes, who I mentioned, Diane Schanzenbach, and sometimes Doug Almond. So the program began in '61 as a pilot. In '64, it was voluntary at the county level, but as I told you, there's this idiosyncratic variation in when counties come in. And then in 1975, it's mandatory. So this design compares changes for me before and after my county got the program with changes in other similar places at the same time that didn't change, okay? So this is a good quasi-experiment. There's plenty of variation across time and places in where the rollout occurred. So this shows you when the program started across this time period by county, okay? So all this analysis I'm going to talk about now is by county. And darker places, I think, are later, yeah. So what you can see is Nevada came in all at once, but in many of these other states, there are both light and dark counties, okay? And you can also see that it's not like uniformly one part of the country became green at one time. There's variation across the locations, okay? So that alone should help convince you this is fairly quasi-experimental, but these other authors have done a ton of work to try to also show that there's not stuff, the outcomes they're looking at are not predicting when states adopted this program, okay? This shows you the time variation. I know this is a terrible graph, but what you're supposed to see, this is the share of counties on the program. This is 1960. This is 1975, okay? So it's sort of ramping in gradually, which gives lots of different time periods at which you can do these little experiments, okay? So what do we know about rollout? Well, existing work shows, first of all, that it changed what people spent out of their pocket on food, and they spent more on away from home, more on out-of-pocket food, less out-of-pocket food spending, more food at home because you had to buy stuff you could make at home because we didn't have microwaves in the 60s. Well, I mean, they probably existed, but they weren't in everybody's house. There were some work disincentive effects of this program, as you would expect, but they weren't that large because it doesn't have that big an earnings disregard. So it's more generous for earning than other programs. And they found increases in birth weight and less low birth weight using the universe of birth certificate data. So it had important effects on kids, okay? Then, what's more relevant for the title of the talk, they find long-run effects on adult health and adult well-being, okay? So they use a panel data set where you know people were from 1968 forward, and they can say, were you in what share of the time when you were in utero to 5 were you exposed to food stamps? And then they can look at adults at age 50 and say things about their health and about their self-sufficiency, okay? So they look at metabolic syndrome, which is a combination of things associated with risk for stuff like diabetes. It's not probably what the doctors would prefer you use to measure this, but it's what's in these data. And they also look at self-sufficiency, which is a combination of less welfare use and more earnings, okay? What do they find? Well, they find a big decline in the probability of metabolic syndrome if you were in a group that had high food stamp participation rates after the program existed, interacted with when you're at what share of the time you were 0 to 5 the program was around in your county, okay? So those are really big effects, and then these are the components. Some of it's working through obesity. That's consistent with this sort of fetal programming idea that if you shock fetuses in a negative way, then they're more likely to be obese later, with the implied hypothesis being if you get a good shock when you're in utero, then you don't have that outcome later. And they also find some reduction in stunting, which is this health below the top 5%. There are some other papers in this emerging literature. So Professor Andrew Barr finds that exposure to food stamps when you're young reduces the probability of incarceration. He does that using both North Carolina microdata, where he knows where kids were born that end up in jail, and he knows how many kids were born, so he can look at the probability of incarceration, and using national data. I have some work with a colleague at Davis and a great student at Davis, Cynthia Vanderwerf, that also shows that the rollout of food stamps changed the food environment, okay? So the program pays for, right now, food stamps pays for about 10% of grocery store revenues, so it's not small. Back then, in places where the program, where the county got food stamps, there was an increase in people working in food and grocery stores using administrative data. Okay, so that's another channel for the program to maybe have an effect, is if it's changing the food environment, it could have spillovers for others. Okay, so now I'm going to tell you about my work in progress here. So with my student Ted, we're looking at long-run effects of exposure to the program. We're using tax records for a 1% sample of Social Security numbers. These are linked to people's places of birth from when they apply for Social Security cards. And our sample is people born in the US from 1955 to 1980 who we could match their place of birth. That's around 90% of the people in this data set, okay? And the nice thing here is it's administrative data, so there's none of these concerns about self-reporting, okay? So we're going to look at outcomes at age 32. We're using this quasi-experiment, so we're controlling for county, year of birth, and then the other stuff that's on this data, which is not very much, gender, and your own, a measure of white, non-white, which is what you put down on your Social Security card application, okay? And then we're going to also control for other welfare spending, so you're not too worried that this is driven by other stuff. These are things that are not food stamps, so other public assistance here, public medical care, the EITC when it comes in, and the SSI when it comes in. And we control for those averaged across the time the kid was 0 to 18, okay? So what do we find? This is just telling you about all the other controls. This is at 32, food stamps through age 5. If you were exposed the whole time, your earnings are between $590 and $650 higher, okay? So that's around a 3% increase in earnings for the whole population. Now, the downside, the thing you could do with the survey data, you can't do with these administrative data, is with the survey data, you could look at subsets like people who were born from single moms, okay? But in this tax data, all we know is you, so, and where you were born. So we can't look at these high-impact subsamples in the way the other work could. So 3% might sound small, but it's for everybody, okay? The point estimates are pretty similar, but the effects are not significant for men. And for women, we also find a 6% reduction in ever having had both SSI and SSDI, okay? So I'm going to skip through. Apparently, I'm used to giving this talk in a longer time period. So I'm going to say one thing about the Head Start Impact Study. That's a more recent experiment from the 2000s. We're reanalyzing this experiment that was done. It's a neat experiment because everybody who had oversubscribed centers had to participate, unlike lots of experiments where you have to go find a school that wants to participate. Here, all the Head Starts had to do it, okay? So it's probably more likely to be representative of all oversubscribed places. We look at effects across the distribution of test scores, and we find big positive effects at the bottom of the distribution. So the people who are benefiting from this program are those who are at the bottom of the test score distribution, which is interesting. And there's some other work that uses the same experiment. These papers find that the biggest effects were also for people who would have stayed home had they not gotten this free slot in a Head Start center. So it's not like it's, if you could get another center that was a publicly funded center, you do about as well as the kids who got Head Start, access to Head Start. And there are positive effects of the program on parenting, okay? So all of those are interesting, and this is some of the more contemporary evidence. And then I'm just going to tell you one thing about Medicaid rollout, or one slide about Medicaid rollout, then I'll conclude, okay? So I shouldn't go too far over my last 2 minutes. A researcher at Vanderbilt has looked at rollout of Medicaid, and he's using variation in how many people were on AFDC before Medicaid started in your state, because all those people got access to the program, okay? So that's another good quasi-experiment. He finds a significant decline in non-white child mortality. And then he has some new work. These guys find long-run positive effects of exposure on health in adulthood using the same PSAD data set that I told you about the food stamp results for. And then in some unpublished work of his, he's finding long-run effects on increased earnings, reduced SSI and DI use, and improved health, okay? I'm going to skip the rest of this and just go to broader lessons for policy. So no surprise, I'm going to say this, but individuals respond to incentives. Negative effects on labor supply have been somewhat mitigated by the shift to in-work welfare. I didn't talk about it, but there's very little effects of these changes on family structure. And that's also true for a lot of these other programs. So effects on family structure are not big. With welfare reform, there haven't been changes. There's been this big decline in teen parenthood, but it's not tied to welfare reform, okay? There are some positive long-term effects of these programs. And I think it's valuable to think of these programs in part as investments. I didn't talk about it, but there's even evidence that if you were exposed to the Medicaid expansions in the 90s, you pay more in taxes, okay? So that's a good message for people who are worried about the cost of these programs. A long-term cost-benefit analysis might turn out differently than one that's just looking at the rate when the programs are in effect. There are trade-offs for policymakers that are clear, and program complexity is challenging and sometimes attenuate the program impacts. So to sum up, I think this is an exciting research agenda, and hopefully it will help inform how we think about these programs. We have to keep studying them because we're now finding 50 years later effects of programs back then. It suggests that these programs will still have some of the things we do now could have effects for the next 50 years, and it would be a shame to not count those impacts as well. Thanks.